Hey people, hey people. My name is Dr. Amit. I am working as an assistant surgeon in Kerala PSC and I have scored a rank of 7191 in EPG 2025. So I thought of sharing the knowledge what I have learned to you guys, starting off with the National Immunization Schedule, which is a very important topic and which is one of the familiar topics of all the NEET-PG aspirants. So what I'm teaching you guys will be based on the previous questions that I've learned. So it will be very precise, not very elaborate. So let's start. So the National Immunization Schedule actually covers 11 nationally covered diseases and Japanese encephalitis in endemic areas. This picture I have taken from the Google and it actually shows what kind of vaccines are given in what age groups. So you can see at birth we are given OPV 0 dose BCG and Hep B. Then at 6 weeks we are giving OPV first dose rotavirus, IPV pentavalent and PCV first doses. In 10 weeks OPV second dose, rotavirus second dose and pentavalent second dose. At 14 weeks OPV third dose, rotavirus third dose, IPV its second dose and pentavalent third dose and PCV second dose. At 9 to 12 months, you are given MR first dose. Along with that, you have to also give vitamin A doses also. IPV's third dose, PCV booster, and Japanese encephalitis first dose in endemic areas. In 16 to 24 months, you are given OPV booster, MR2 second dose, DPT booster, and Japanese encephalitis second dose. Then 5 to 6 years, you are given DPT booster, 10 and 16 years you are giving TD instead of TT, and in pregnant women you are also given TD first and second doses and TD booster only when the pregnancy is within 3 years from the last pregnancy. So I have made a cartoon which can show what are all vaccines that are given in your right upper arm and your left upper arm, which is actually was very confusing for me during my preparation. So I made like this. So right upper arm, you are actually given IPV 0.1 ml intradermal and the measles 0.5 ml subcutaneous. And the left upper arm, you are actually given BCG 0.1 ml intradermal and Japanese encephalitis 0.5 ml subcutaneous. So till 1 year of age, what are given actually? BCG, Penta and Lota can be given till 1 year of age, and till 5 years of age you can give OPV and MR. So if an unvaccinated child comes to your OP and asks for a vaccination, you have to give the exact vaccine which is appropriate for his age. Now for the live vaccines. So the live vaccines actually are contraindicated pregnancy. So it includes BCG, MR and varicella, which are and etc., which are contraindicated pregnancy. So between two live vaccines, if you are in a state you have to give two live vaccines, there should be a minimum gap for 4 weeks. And influenza and yellow fever vaccines are contraindicated in egg allergy. Diluent was also a previous question. Diluent for BCG is sterile water, for Japanese encephalitis is phosphate buffer, and for measles and MMR it's distilled water. I have said earlier, TD booster is given if a pregnancy is within 3 years from the last pregnancy. We don't have to give the full doses. So now adverse effects following vaccination. BCG, if it's given, the most common adverse effect that can happen is a suppurative lymphadenitis and also a disseminated BCG infection. If it is inactivated influenza, you can get Guillain-Barré syndrome, measles, thrombocytopenia, and febrile seizures, OPV, vaccine-associated paralytic polio, and DPT, neurological events, and persistent cry. These are actually previous questions which are asked once or twice. Open vial policy is actually a previous question. Open vial policy is when the government of India has initiated the reuse of certain vaccines once they are open till a period of 4 weeks to reduce the shortage of vaccines. But there are some vaccines that are not following this criteria, which include BCG and measles. Earlier there was Rota and Japanese encephalitis, but I recently found out that they are not in use. They are exempted from this criteria. So the only one not applicable is BCG and measles. Temperature sensitivity is also an important topic. What are all heat sensitive, what are all cold sensitive? Heat sensitive include BCG, OPV, measles, varicella, rota, and Japanese encephalitis. And what are all cold sensitive include Hep B, DPT, Hep B and DPT. So let's see what are the live vaccines, killed vaccines, recombinant ones, and the toxic ones. Live vaccines include BCG, mumps, measles, rubella, rotavirus, typhoidal vaccine, Japanese encephalitis, SA1414-2, varicella, and OPV, which is a Sabin strain. And killed vaccines include rabies, OPV, Salk, Hep A, inactivated typhoid, and cholera. Cholera is actually contain two vaccines, Dukoral, which is a monovalent, and Shanjol, which is a bivalent. This was a neetpg 2024 question. Recombinant ones include Hep B and human papillomavirus vaccine. Then toxoid ones include diphtheria, tetanus, anthrax, pertussis, and influenza. Tetanus post-exposure prophylaxis, which is given based on certain criteria, like if the A category A means if the person is fully immunized or booster is taken within the past 5 years, or B category if it is taken within the 5 to 10 years, C which is more than 10 years, and D which is an unknown period, or he has never taken any kind of vaccination at all. So if he is a category A guy, then you have to give, if it is clean wound, only wound care is required. If it is unclean wound, also wound care is only required. If it is B, if it is a clean wound, wound care plus a TT single dose. Unclean wound also same treatment. Then if it is C category, if it is more than 10 years, if it is a clean wound, then he had to give a wound care plus a TT single shot. If otherwise it is an unclean wound, then you have to give wound care, then a single TT dose, plus you have to give immunoglobulin also. If it is a D category, if the person has not taken or if it is taken at an unknown period, then you have to give wound care plus a complete TT dose in a clean wound, and in an unclean wound you have to do wound care TT complete course, then also you have to give the immunoglobulin. Rabies vaccination is also important. It is important for neetpg preparation also. It is also important for when you are working in a district or CHC hospitals. So it's basically you have to know it by heart till your life. So the category 1 includes when licks on your intact skin. Category 2 include minor scratches or abrasion without any kind of bleeding. Category 3 include multiple scratches or bleeding. So you should be always in a state to differentiate between these three situations so that you can refer them to a higher center, or you can administer the rabies vaccine or the immunoglobulin at the time when the patient arrives. So the category 1, if it is not immunized, you have to give an wound washing only. Same thing, previously, if it is previously immunized, you have to give wound washing. So category 1 means it's on an intact skin, so primary treatment just wound washing is only required. So category 2, if it is minor scratches or abrasion without bleeding, if it is a non-immunized guy, you have to do the wound washing and you have to give a post-exposure prophylaxis. And if it is a category 3, in a non-immunized person, if there's multiple scratches or bleeding, then you have to do wound washing, post-exposure prophylaxis, and then in the immunoglobulin should be given. If it's a previously immunized person for category 2nd and 3rd, you have to give wound care with a booster dose. Booster dose can be actually given during day 0 and day 3. So it is only required like that. It can be either intradermal or intramuscular. So what are the post-exposure prophylaxis that we can give to these guys? Actually, there are two regimens for us. That is SM regimen and thigh let course regimen. SM regimen is a single site intramuscular regimen which are given on day 0, 3, 7, 14 and 28. And for thigh let course regimen is a two-site injection intradermal which is given on 0, 3, 7 and 28. So also, for the pre-exposure prophylaxis, pre-exposure prophylaxis are normally taken by people who handle animals. So they take the injection either on day 0, 7, 21 or 28. Now, what is the dose of the immunoglobulin that you can give to a person? It is a human recombinant immunoglobulin. You can give 20 international unit per kg. If it is an equine, then you can give 40 international unit per kg.